Hello and welcome back. This is session 2 where we're going to be discussing how the naturopathic principles relate to flower essences, and then we're going to dive into some of the bark flower remedies themselves. So we're going to spend the next couple of sessions dedicated to the bark flower remedies, and then after the mid-semester break we're going to be doing Australian flower essences from all different types of essence sets. So to start with the naturopathic principles, where does flowers fit in? And we talked a little bit about this in session 1. So hopefully you've got some ideas already in your head that you've been putting together. Hopefully these 6 principles look well and truly familiar with you. And I just wanted you to have a look at them for a moment and have a think about how does flower essence therapy perhaps fit into the naturopathic philosophy, the system itself and the principles that underpin it. So obviously I tend to begin with first to know harm. I'm not sure why, I've just always begun the 6 principles of first to no harm. I think for me it's the most important, and it's also probably one of the biggest in terms of the philosophical ideas around it. And first to no harm to me means finding the intervention that's most appropriate for the person and not going further than what's required in order to let the healing power of nature do its thing. And when we look at an individual's vitality and we consider how that person is unique, sometimes an intervention as gentle as flower essences and that target perhaps something specific like the emotions rather than the physical disease itself may be what's most appropriate at that time for that person. And if you can enact a healing shift, if you can assist the healing power of nature to do its thing with minimal intervention, then to me that upholds the first principle, first to no harm. It respects the healing power of nature. Of course, you're treating the whole person. You're finding out which aspect of that person is most out of balance and how can I appropriately treat them. Treating the cause, this is an interesting one. And certainly flower essences, for those who are interested in it and really respond well to flower essences, it can take you on an incredible self-discovery journey. Like I was saying in the first session, that onion theory, with each essence that you take, you can kind of understand in a part of the self that perhaps was hidden, or you had a not so healthy or happy relationship with, and you can learn more and more about who you integrally are as a soul, or as a spirit, or as the very essence of who you are, through progressive workings with different flower essences as different things come up. There's also, because Bach spent a lot of time connected with homeopathy, he was fascinated by the homeopathic principles, there is an element to Bach flower therapy and that kind of ripples out in this idea of constitutional flower essence. This idea that when you find the remedy that best suits you as an individual, that kind of ticks the boxes for when you go out of balance, when you have additional stressors that are placed on you in your life, what is the most likely reactory pattern? What is the most likely way that you break? And is there a flower essence, flower remedy that kind of really nails that for you? And once you recognize that, it really assists in kind of it's like a you can recognize the red flag for when you're going out of balance. It can be really helpful. Physician as teacher, we talked last week about the importance of taking responsibility for health and how flower essences can work really effectively in that way. So I'm not going to go more into detail about that, but just so you can start to really place it and the importance of that idea in the principles of NAT. And prevention better than cure. When you recognize what it is that throws you out of balance, and emotional components can be such an integral part of understanding the preventative aspect of healthcare, then we can assist in the much bigger picture of healthcare in our society at large. The next slide is the therapeutic order. Again, this should be very familiar to you. I'd be interested to know where you personally think that flower essences may fit within this therapeutic order. I tend to put them into level 2 as an intervention to stimulate the healing power of nature. We talked about flower essences having their own vital force and how that can affect your vital force or your patient's vital force. So I tend to put it into level 2. You could argue that it might also be level 1 if you are removing a disturbing factor by helping someone to understand the emotional aspects to disease, for example, then you're removing a potentially major obstacle to cure, and that may make sense. In the same way, flower essences may assist in tonifying weakened systems. So it may be that that vibrational medicine is all that's required to help bring an organ system back into balance that may have been affected previously. So it's, for me it's number 2, but I understand if you felt it was number 1 or number 3. There's really no right or wrong answer here. And like in all naturopathic philosophy and the principles that underpin it, it is a merger of all of these ideas. Assessing the correct remedy. This is going to be, this is such an individualized aspect of flower essence therapy, and I find that each flower essence practitioner or naturopathic practitioner that uses flower essences within their practice goes about this in different ways. And sometimes it really depends on your underpinning skills and what you feel most comfortable with. So Ian White from the Bush Flower Essences, Australian Bush Flower Essences, suggests a couple of modalities that he personally uses in a lot of detail. So he uses a lot of numerology, kinesiology, iridology and astrology. And he goes into detail about the connection between those modalities in his book. So if you're wanting to know a little bit more, then that's the case. But what he's trying to do there is figure out, this person that's sitting in front of me, are there fundamental aspects of their constitutional self that may give me an indication as to where they first break? Where, when stresses are placed on them, do they fall apart? And so those methods of understanding the individual can be really effective, and can be more effective sometimes even than when you are in clinic having a conversation with an individual. I'm guessing by now you have at least done classroom-based clinics, and you've probably certainly done observational clinics. And perhaps you've been in situations where you've recognized, okay, this patient perhaps isn't telling the whole truth, or for whatever reason, or this patient, for the last couple of months has been telling us this, and then all of a sudden has suddenly felt comfortable with this and has divulged this further information, but we really didn't know it for the first couple of months. So that happens in human interaction, and these are modalities to try and get around that. Barno, this is the living essence range that we'll also be studying, suggests two specific diagnostic techniques called flower affinity and Barclay diagnosis. And this has to do with using flower essence cards as a method of, again, kind of shortcutting what's happening. What I sometimes see in clinic is people making assumptions as to what the underlying emotional cause of the disease is. And there's lots of reasons and lots of theories and lots of philosophies around how disease connects with emotions. But what I've found in clinical practice is that you can make those assumptions all day long, but most of the time you're wrong, or you've got an incomplete picture of what's happening. It's too simplistic. And to really nail a good flower essence remedy, you need to understand that person in much greater detail. Not always, but the most effective remedies that I've given have been when I've truly understood what's happening for that person, when they felt comfortable to divulge that. So flower affinity is the use of flower essence cards, and they believe that each flower is like a pictorial representation of an emotional imbalance. So your subconscious mind gets attracted to the doctrine signatures, gets attracted to the color, the shape, whatever that picture is, whatever stands out in the subconscious, it's reacting to the learning pattern of that flower. And Barclay diagnosis is the use of the stock bottles themselves on top of somebody's head, on the crown chakra, when we were talking about chakras last week, as they talk you through what's happening emotionally for them. So I've given you some page numbers from the 1997 text they have, and that goes into a great more detail about these things if you're really interested. And pendulum dowsing is another method that you can use. So the first flower essence range that we'll be going through are the bark flowers. And as I suggested, his name was originally pronounced Bache, but his flower essence students, when he was originally teaching, pronounced it Batch for a while, and then it became Bark because everyone was familiar with the musician and just kind of superimposed same names, must be the same sound. So I'm going to use the word bark even though that's wrong, because a lot of people use it to this day, but it's actually Bache is the correct way to pronounce it. Actually, I'll use Bache, and hopefully you won't flip out about that. So Edward Bache was born in 1886 in Birmingham, England, and passed away in 1936, so quite young. He studied medicine and worked in the bacterial and immunology departments of the hospital where he was working originally. And he moved into homeopathy. He got very interested in homeopathy and actually worked at the homeopathic hospital, which is still in London to this day. And he got fascinated by Hahnemann's ideas on cure, and particularly the idea of less is more. Dosing and posology he was really interested in. Now, he was already quite a well-known bacteriologist, and he wanted to apply the principles of Hahnemann to the work that he was already doing. He was working in the gut, and he saw that there was some connections between various bacteria that people had kind of overgrowths of and emotional states, and he got really fascinated by that and started to look at bacteria from a totally different point of view. So he made up homeopathic preparations. They're called bacterial nosodes, still available today. And that's where it all started. He then got fascinated by this idea that plants were kind of more pure. He no longer wanted to work with the animal kingdom, he no longer wanted to work with bacteria, he wanted to work with plants. His health took a turn for the worst and he moved out to the countryside, the English countryside, where he felt supposedly more connected to the land and more at peace with himself. So he closed up a very busy practice in London and moved to the countryside and started to make flower essence remedies using the homeopathic ideas. He came up with the sun method and the boiling method, and he had lots of theories, and he took lots of case notes. Unfortunately, he burnt all of them, and his reasoning was that he wanted a system that was devoid of theory, that was very simplistic. He suggested that nature in its healing methods were very simplistic, and he wanted to mimic that. He didn't want people to overthink his system, and he certainly didn't want there to be a division between the ordinary person and healing. He wanted everybody to have access to this form of medicine. Towards the end, he did write a lot about different ways that he viewed health and disease, and how the current medical system was perhaps not helping to address certain major aspects that he saw of disease. And a lot of those writings I've given you in session 1, so if you're interested, they're all freely available. All of his writings are freely available online. And if you're interested in his ideas, he became his spirituality really came through towards the end, and he describes connecting with flowers and being in a silent meditative state and suffering a disease state, like an emotional state, and then being strongly attracted to a particular flower. So by the end of it, he was being attracted to the flower rather than going out and seeing what the flower did, which was his original method, which is based in homeopathy. So during the 30s, Bach discovered his flower essences. He discovered a few first, so the 12 healers, and wrote a book about them, and then kind of kept building upon them. We're going to learn all of his flowers. So this is giving you an idea of his, I guess, more spiritual view of flowers, and it's also a way that you may like to describe flower essences if it speaks to you. So he felt that the subtle vibrational energies of the flower essences could assist in realigning emotional patterns of dysfunction. By enhancing the alignment of the physical personality with the energies of the higher self, greater harmony could occur within the individual as reflected by greater peace of mind and expression of joy. And I've put in a couple of quotes from Edward Bach. This one was from Heal Thyself, which is quite a beautiful book to read if you're so inclined. Healing will pass from the domain of physical methods of treating the physical body to that of spiritual and mental healing, which by bringing about harmony between the soul and mind will eradicate the very basic cause of disease, and then allow such physical means to be used as may be necessary to complete the cure of the body. And when you think about the naturopathic principles, to me that speaks of first do no harm, trying to find an intervention method that's least invasive, and then moving forward if it's indeed needed. So, as I said, Bach did 2 methods. One was the sun method and one was the boiling method. And I've just listed the sun method and the boiling method flowers for you, because there is a theory, and I just told you that Bach was not a fan of theories, but this is one theory that's come through from one of his devout followers who's created his own Bach flower remedies set. And this is Bernarda. I've given you the reference to the book in the back. He's written quite a few books on this, and I have shown you a couple of YouTube links to him discussing a couple of the batch flower remedies. So the 12 healers were his initial flowers, and you see them in the middle there of the circle. And these were considered the constitutional remedies. This was at the time when he was moving from homeopathy into his own energetic treatment system. And homeopathy, the homeopathy that he studied was constitutional based homeopathy. And so we see this really reflected in his writings about those 12 healers. The next one further out in that flower are the 7 helpers. So these are chronic habitual emotional conditions that mask the soul type or the constitutional type. So the idea was that the 12 healers are who the person is at the core and how they're thrown off balance. The 7 helpers are like a big chunky layer of an onion that kind of masks what's going on in the very middle. And this can be, for instance, learnt patterns of behaviour, so ways to mask who an individual truly is. So they can present in a certain way, but once you peel back those layers, you find the soul type underneath. And then 19 remedies which were made by the boiling method, and this is kind of central to Bernard's theory, is that the boiling method is emotionally reactive or traumatic states that are happening in the here and now. They're acute, and they kind of need to be addressed in the here and now as an acute form of treatment. And this was the last remedies that Bache made. So that's just one way of looking at things. And it's an interesting way of looking at things, so that's why I put it in. If it resonates with you and it makes sense to you, then great, use it. So with dosage, which is obviously important, with your Bache remedies, it's 2 drops from each remedy of the stock bottle to 30 mils in your dosage bottle. So what you're going to give to the patient, top that up with mineral water. Remember that the Bache flowers didn't suggest adding additional preservative, and take 4 drops a minimum 4 times a day. Now remember, these are English remedies, and the climate is very different. So it may be that you might like to consider adding additional preservative in order to make sure that the dosage bottle that you give to your clients lasts them for a couple of weeks. I'm in Queensland, for example, and if I did this with a mineral water, I probably wouldn't get 2 weeks out of it in the height of our summer. So just something to consider. You can also put 2 drops from the stock bottle straight into a glass of water and take sips for that. So you can either sell the stock bottle to a patient, or if somebody's in your consultation room and something traumatic is happening and they're not able to continue with the consultation, for example, then, and they're familiar with flower essences and they give you permission, then this may be a way to treat them. And of course, family, friends are the guinea pigs. You can, and you have the stock bottles, you can use it in that way. Rescue remedies, the only difference, that's 4 drops into your 30 ml dropper bottle. So that's it for the bark flower remedies introduction. Next we're going to be going into the remedies themselves. So get ready.